Hello, hello. Happy Wednesday. Happy Wednesday. I am here today to go over a few things. How are you guys doing though? So much is happening. I won't be on for very long, just long enough to update you on what I've been up to and to answer questions if you have them, as well as let you know what's coming. So I have so much going on. And the question was, well, where do you start? Where do you start? So for those who are catching this and aren't aware of who I am, I'm Dr. Cindy Duke, medical director and physician and laboratory director at the Nevada Fertility Institute in Las Vegas, Nevada. I'm also a PhD trained virologist who has been doing a lot of work in explaining coronavirus COVID-19 from a virologist's perspective and really helping to debunk some of the myths that are out there. I recognize and understand that people are living in a very difficult time and everyone is looking for a solution. And as someone who grew up outside of the United States, I appreciate that there are lots of remedies that fall outside of what some might describe as traditional medicine. And so my hope is to debunk those myths when and if necessary. And so I've done that sort of work, and I'll talk to you more about what I've done unwritten so that you can find that information if you were so inclined. I am, like I mentioned, a physician, a scientist, a PhD trained virologist. Well, actually, my full PhD is in microbiology, immunology, and virology, but my focus was especially virology, working with viral vectors, HIV, herpes, virus vectors, and manipulating the immune response so that we can actually develop vaccines. So, yes, I spent 4 years of my life working specifically on vaccine design. That's all I worked on, designing viral vaccines and characterizing the immune response that's necessary for an effective viral vaccine. As a matter of fact, my PhD work was actually awarded one of the top papers from the Institute of Medicine in the year that it was published because it had done such a good job in really characterizing what is needed for an effective immune response against HIV. And I bring up HIV today, even though this is a conversation more about COVID 19 and coronavirus, because HIV is still by and far our a white whale in the world of virology. It's still that virus where we know people develop antibodies, they develop an immune response to HIV, yet we're not yet able to have an effective vaccine for it, nor are we able to effectively characterize how to stop the virus from infecting cells all the time or from propagating itself when it's in a cell or shedding. And I think it's important to know that kind of stuff because everybody keeps talking about getting a vaccine for coronavirus and COVID 19, which is our focus. Because until then, we won't really be able to get back to the way of life as we know it. But it's really important to understand that vaccine biology is very interesting, especially when it pertains to viruses. One can make an immune response, but it not be the immune response that will actually clear the virus. One might have an immune response that can help what we call abrogate the response to the virus, but again, not prevent its infection. And that's actually the premise behind a lot of our viral vaccines as it relates to chickenpox or the shingles virus, as it relates to measles, mumps, rubella. We're not really doing those vaccines to prevent infection. It's more so that when you are infected in the future, your immune response can adequately address it and fight it off before it gets worse. And so I think it's important for everyone to know that. And I appreciate all the questions, comments. I will certainly be getting to those as we work our way through here. So that's the important thing to talk about. But I wanted, first of all, just to say to everybody, I hope you're doing okay. I know this is hard. I think being at home and working from home, while for some people, this is what we call an old hat, they've been doing it for a while. For a lot of us, this is new. The concept of working from home and working from home full time is new. And then you couple that with the fact that you can't even really leave the house, even if you were not working. I think that really changes things, even for those who've worked from home before. If you're watching today, you're amongst the first people to see me on all channels. So I am live streaming today, not only on Facebook, but on Twitter/Periscope and YouTube. And so I'm excited for this opportunity to talk to you as well. In terms of what I wanted to go over today was, yes, to introduce myself, explain why this sort of stuff is of so much importance to me, a fertility specialist. I know some people were like, well, why does she feel like she can come out and talk about viruses? Well, that's part of the reason why. But also because as a fertility specialist, COVID-19 and coronavirus actually is impacting very directly my practice and my patients. My patients are reproductive age women and men, people who have been working for a long time to grow their families, to achieve their goal of parenthood for many of them. And then when this happened, it actually did change a few things in our field as our approach had to be tailored given the current circumstance. And so a big part of why I'm out here is really to help people understand what's going on, let them know that I'm aware of what they're struggling with, but also to answer questions. And so it's important that we talk about it. I think talking about it is critical for just surviving this stuff and making our way through things. So I see some people already commenting. Hi, Beverly. Hi, Catalina Doc. It's, I love the fact that I can talk to people across so many different platforms as well. Hi, Tanisha. Hey, Earl. Thank you. Thank you. Thank you so much. And so that's why we're here. Now, also, like I said, I'm here to introduce myself. Allow me to introduce myself to those who aren't familiar with me. And so, in addition to being a physician, a scientist, I also write. I like to blog. I like to help get the information out there. Hi, Betty. And so, you can find my blogs on my website at drcindyduke.com. I've actually been creating quite a few blogs as they relate to COVID-19, coronavirus infection, distinction between coronavirus infection and COVID-19. So many people don't quite know that having coronavirus infection doesn't equal COVID-19 disease. As a matter of fact, yes, COVID-19 disease means coronavirus infection, but not everyone who has the infection will have COVID-19. And that has been lost in our messaging for quite some time. And of course, it's also why some people are confused by the notion of people being infected but being asymptomatic. And I want to clarify that because the truth is, it's not that it's been bad messaging. For those who have been following me now for the past month, it's been well over a month that I've been telling people that some people will be infected. They will make more virus. They will shed virus. And it's important to understand that as someone who is a carrier, a transmitting person who's transmitting a virus, you're shedding it. And so viral particles shed in cells and outside of cells. So when we talk, droplets of air that come out of our mouth because that is exactly what's happening. We're a living, breathing organism. We're breathing air in and out. Even if you're not consciously thinking about it, in order to talk, you're breathing as well. You're actually actively breathing air in and out. And so, in the course of breathing air in and out, if you're someone who's an asymptomatic, or any person actually infected with the virus, but especially the asymptomatic person, every time you breathe, you are shedding virus and cells are coming out. Every time you talk, cells are coming out that have virus or just viral particles in and of themselves within droplets of sputum, etc. And so you can be shedding virus and not know it. It doesn't mean you're somehow irresponsible, you're somehow trying to hurt people. That is just the way viruses work. You can shed virus asymptomatically. And if you're shedding virus, then you need to take precautions. And so for a virus that is this contagious, it's important to practice good hygiene, because viruses can survive on surfaces. They can survive. And the word survive is a misnomer, because the virus isn't alive, but it's capable of infecting you. And that's what we mean by survival when we talk about viruses, is it's capable of infecting you even after being outside of the human body for some time. And so it's important to know that kind of stuff and to understand what you're dealing with and why you can be perfectly fine, perfectly healthy, not having had any symptoms, and still be spreading the virus. Data coming out of Wuhan, China, out of Iceland, out of New York City, out of Italy, for example, where they're looking and testing a lot of people, out of Germany, and they're seeing that anywhere between 40% to 80% of people who tested positive for coronavirus have zero symptoms, right? They only found out that they have the virus infection because they were tested. So it's important to know that. It's important to understand that you could be that person who, if you actually got tested, would be positive, may have been positive for a while, but didn't have any symptoms. And it's important that you know this. And so it's why you should wash your hands, not just because you're afraid of being infected from someone else, but to help prevent you from infecting other people. Why you should maintain social distance, physical distance, really is what we're talking about. Stay home as much as you can, avoid congregating. Really, the only people you should be hanging out with right now in person are the people who share a household with you, not just your family members, but people you share a home with. In terms of going outdoors, if you go out, we're recommending wearing a mask. I know for me, I've always said a mask will be helpful, but we've been short on supplies for masks. But again, if you breathe, you can actually shed viral particles into the air. So it's not just that you can breathe in particles from someone else, you can be spreading it. And I think it's important that we all know that the risk of spread isn't simply of you catching it from someone else, it's that you can spread it to someone else. It's very important that we understand that and recognize our role in all of this. It's really important that we recognize what our role would be and how it plays a role. So that's really my coronavirus COVID-19 spiel for today. My goal is to do these regularly, quick 10-minute videos, 5-minute videos, just to drop some pearls, but also to answer questions. So if you have any questions or comments, put them below. I released a blog and a Medium article on Monday debunking 8 of the more common myths about COVID-19 that I've seen patients and other people circulating. And so I'm actually looking at my phone just to review the 8 myths again and to remind everyone that, there's something called pseudoscience. And pseudoscience is basically the premise behind which something sounds like it's founded in facts and science and research, but in fact, it's not. And whenever that happens, you have to be careful because you can quickly fall victim to information that can only harm you or those around you or your loved ones. And so it's critically important that you learn how to appraise information. I am not telling you this because I want to insult you or insult someone else. It's more that I want you to know how to keep yourself and your family safe. The last thing anybody wants right now is to accidentally take some medicine or take a homemade remedy that lands them in the hospital. That's the last thing anybody wants right now. And so it's important to know this. If you're reading things about steam, let me explain. Like I said, viruses don't live, they're not alive when they're outside of the body. So as soon as they interact with human cells, the goal is to get in the cell. They're not hanging around for 4 to 5 days, as some of these stories that I've seen out there suggesting, these remedies. Hot water, steam, there's no impact that's going to kill a virus in that regard. You're more likely to harm yourself by steaming or scalding your face, landing yourself in the hospital with a burn. It's important to know that heating up alcohol, boiling methanol, drinking methanol, these are all poisons we're talking about here. Even straight alcohol can be explosive. The same for methanol, or what some people call jack iron. These things are explosives that you're dealing with that you can really hurt yourself and your family members with. So be careful, be aware, and try not to harm yourself. So the 8 myths, if you go for my article, you can find it online. It's on my website at drcindyduke.com. It's titled Debunking Myths About Coronavirus/COVID-19. And, the headlines are including things like myth number 1, no cough, no fever. Hence, I don't have the virus. Yes, you can have a cough and fever as signs of the virus, but a lot of people have no symptoms at all. Remember that, right? 40 to 80% of people who are positive for the virus don't have symptoms. That means if you took 10 people and tested them, actually, if you had 10 people who tested positive and you asked 4 of them if they had symptoms, at least 4 would say they never had symptoms. And maybe as many as 8 of them will say, I've never had symptoms. If you took 10 people who were positive, keep that in mind, right? So don't give yourself a false reassurance because you don't have symptoms or you don't have a cough, fever alone. The other one is, the myth that people seem to think that if they actually they're living in a warmer climate, hot weather, they're fine. That's not true. We don't have evidence right now that warm weather will just prevent infection or spread of the virus. That's not true at this point for sure. And I don't think it's going to be at all because that is not how coronaviruses work. Myth number 3, if I got a vaccine for pneumonia, I'm good, because I keep hearing people saying that people with COVID have pneumonia. So if I got my pneumonia vaccine, I'm good. I can go out. I don't need a mask. I don't need to practice social distancing. That is not true. The vaccines that are out there for pneumonia are pretty much for bacterial pneumonia. Coronavirus, it's a virus. So you're not going to be protected that way. As a matter of fact, we have no vaccine currently for coronavirus. And it's because of all those difficult things I described at the very beginning, which is when you're designing and doing vaccine work for viruses, the immune response that you see to the virus doesn't necessarily equal the immune response needed to clear the virus. And so it's important, and that's why it's going to take time to develop a vaccine. It's not simply saying, oh, this person has antibodies, let's just make those same antibodies. Absolutely not. As a matter of fact, to blow your mind, everybody who's ever been infected with a herpes virus, you have antibodies to herpes. It doesn't mean you're not going to keep having activation of herpes in your body. Similarly for things like measles, similarly for chickenpox, it doesn't mean you are now immune. It's the reason why also we need the flu shot regularly. The do-it-yourself remedies. The article goes into detail about that. We talk about 5G radiation. I think it's very worrisome that this particular story has gained so many legs and people have chosen to believe it. Now, if you choose to believe it, I can't stop you. But I think what's dangerous is now it's being spread, and out of a need to hear something that has an answer to what's going on, because yes, this is difficult to accept and appreciate that doctors don't yet have a confirmed treatment for the virus, that we don't have a vaccine. And so we're eager to look for any other explanation. But that is not how 5G works. 5G does not cause COVID 19 disease. COVID 19 disease is caused by infection from coronavirus. And in a subset of people, they develop really bad symptoms that can land them in the hospital and even cost them their lives. That's the truth. You don't have to believe it, but it's the truth. There's only one truth here. Myth 7 would be the one that people have been also propagating, that says people of certain ethnic backgrounds cannot get the virus. And unfortunately, there's still people in this moment telling other people that if you're Black, if you're of African heritage, you won't get coronavirus. Look at Africa. They don't have coronavirus. That's not true. There are people in Africa with coronavirus infection and different countries in Africa. Because remember, Africa is not a country. It's a continent with well over 50 countries, 50, okay? And so just like not every other country on any other continent has high numbers of viruses, there are some countries in Africa that don't have high numbers, while others do. And so it's very important that we all appreciate that and stop believing silly myths like, oh, Africa doesn't have the virus, ergo, Black people are immune, and so we can do whatever. That's not true. And as a matter of fact, unfortunately, oh my God, guys, the stories are so sad. Right now, in the cities in which they're tracking the numbers, disproportionately, the people who are dying from COVID 19, there are higher rates of people of color, particularly people of African heritage, are dying. Black people are dying. So in some cities, 3 to 1. For every 3 Black people that die from COVID 19, 1 non Black person. That's a big deal, guys. That's a big deal. And of course, it's what we call multifactorial. It's due to things like underlying disease. We tend to have more diabetes, more hypertension, more underlying disorders, but also we have disparities in access to care, access to testing. But we also have disparity in that there were these myths that were spread amongst communities of color that led them to believe they were immune and therefore did not need to take any greater steps other than feeling confident that their color of the skin conferred some special immunity. Not true. We're all human beings. Skin color is one thing, but our immune systems work in very similar ways across all ethnic backgrounds. We're one species, after all. We're still one species. And coronavirus, which is known as SARS-CoV-2, this virus, infects humans. Now we're learning that humans can also transmit it to cats and canines, not the other way around, but primarily it's human to human transmission. And so it doesn't matter what the color of your skin is, you're a human. And if another human is infected, they can infect you. Plain and simple. Please remember that. There's no special immunity. There just isn't, right? And lastly, that certain blood types are immune. There's no blood type that confers immunity to this infection. Again, I want you guys to remember that and know this. So those are the big things I wanted to harp on today. We call it harping on for COVID. And to remind everyone, it's still about the basics. Hand washing, hand washing, hand washing, soap and water for 20 seconds. If you cannot get soap, then get alcohol-based sanitizer, at least 60% alcohol. Making a sanitizer that just has essential oils and aloe vera is not enough. to break down the virus. It will smell good, sure, but you're not actually doing anything to the virus if you don't have 60% alcohol in your cleanser. Keep that in mind. I've talked about lemon water, etc. Vitamin C, we know, can play a role in certain types of infections, but honestly, lemon water doesn't have a lot of vitamin C in it. Let's just be honest. If you want to drink lemon water because it tastes good, absolutely. I do it. I grew up in the Caribbean. I make something called bush tea. I concoct all different herbs and it makes me feel good. It's part of my general health and wellness. It's part of my attachment to my culture. It's, in my opinion, part of my attachment to my ancestors. But at the same time, I am very aware that that does not keep me from getting sick if I became infected. I understand that. And I want you guys to try to put the two together, okay? It's not one or the other. Science and culture, science and tradition can work together. You just need to know when to apply them and when to not hurt yourself and others because you're just deciding that science makes no sense. Part of what's going on today is proof that we need science, okay? It's thanks to science that we can even identify that there's a virus at play here. If this were 200 years ago, where they didn't yet know about viruses, this would have been known as the plague and God. Just imagine how much worse this would be. So keep that in mind, guys. Okay, that's all the bad news today about COVID. I do have some updates. For those who've seen some of my social media posts, I was featured on my first magazine cover recently. And so you can see it on my social media pages. I was featured in Elise and Company. As a podcaster, I met the owner of the magazine through my podcasting, and she said, "Hey, would you like to contribute to my magazine?" I sent in my contribution. She wrote back and said, "Good news. We've looked at everything. We'd like to make you the cover feature." And so I thank her and I thank the company. It's pretty neat. It's a pretty neat feeling. Other things that we have going on, GriPSSI podcast season 2. First episode of season 2 will drop next Monday. And so look forward to it. Again, GriPSSI podcast is available on iTunes, Radio Talk, Radio Public, Spotify, pretty much anywhere, Google Play, that you can hear podcasts, you will find it. Other things that I have going on, let's see. In terms of work, I'm still working, mostly from home, but I'm doing telemedicine, seeing somewhere between 5 to 7 patients per day on average. Right now we're averaging 7 patients per day. And they're patients who are either new to infertility and getting consultations versus others who have already been in treatment and are seeking to plan for when we can get back to treatment. And so we're doing that. Lots and lots of telemedicine. It's easy. You just have to call a phone number and they will schedule you to see me. And so the number is actually 702-936-8710. Yes, I'm located in Nevada, but I can see patients who are here and also in other states, as well as those who are calling from outside of the United States. Yes, indeed. For those who are in Trinidad and Tobago, you're watching from the Trinidad and Tobago Center for Comprehensive Women's Health. You can also request a consultation via that Facebook page and the website, and they will be able to put you in touch with a doctor who can see you if you have questions. Lastly, what do I have coming up otherwise? So we've talked about the podcasts and episodes coming out for season 2 next Monday. Really great guests. We have guests that include a young fashion designer from Trinidad and Tobago and her story, how she went to college in the United States, how she got her training, how she's since been using her training to build a brand. We have a student who's currently at the University of Nevada, Reno, who has been doing amazing things in terms of advancing causes of student diversity, as well as using her platform to educate girls about science and robotics. Yes, she designs robots. She's pretty amazing. You guys would love to meet her. Also, you will have an opportunity to meet a number of other amazing women from around the world. At this point, I have interviewed women from every continent in the globe except Antarctica. And so season 2 is pretty exceptional, and first episode drops next Monday. As Dr. Renee says, not sure if you covered this, but can you talk about ASRM guidelines during this pandemic? I alluded to it, but you're right. I didn't go into it in detail. So ASRM, the American Society for Reproductive Medicine, has issued guidelines. So they're not law, but they're strongly worded guidelines or recommendations that have recommended that fertility providers not pursue pregnancy currently. Meaning, if you're a patient who is doing either in vitro or insemination, IVF or insemination, we should delay putting an embryo into you if it's an embryo transfer, or doing an insemination until this is all sort of abated. For two reasons, like I mentioned earlier on. One is because of resources and really working to preserve resources for the frontline workers who need it. The other was to help decrease the spread of this highly contagious virus to patients, but also to clinical staff like myself and my staff at the clinic, because the truth is our healthcare system is currently overwhelmed. The last thing we want to do is to really go ahead and start adding to it by making more people sick. The good news is more and more cities and states are getting a handle on their coronavirus COVID-19 infections. And so one, ASRM, the American Society for Reproductive Medicine, is monitoring, and they every 2 weeks or so have been updating their guidelines, their recommendations. So for example, this past Monday, actually Monday a week ago, not this Monday, a few days ago, they actually loosened the guidelines a little bit by adding a few more caveats. So initially they said you should only do IVF for patients who are imminently in danger, like cancer patients who need to get their eggs out so they can go on to get their life-saving chemotherapy. Now they're saying it's not just cancer patients, but patients for whom this may be considered urgent. And so that can include your patients who have a very low egg number, those who are above a certain age where time is literally egg. It could include those patients, but really it still also includes ensuring safety. Safety for patient, safety for doctors, and safety for the community at large. You know, we're still part of a big community. So I will tell you that at my clinic, we are working really hard on that safety part. At my clinic, we're practicing social distancing, even for patients. So in our lobby, there's never really more than 2 patients in the lobby. We've limited guests who can accompany a patient if they came to the clinic. We have spaced out our ultrasounds. Everybody in the office wears a mask to decrease one chance of us contracting virus from an asymptomatic patient, but also for the converse, which is decrease the chance of us infecting a patient who walks in. Now, the truth is COVID-19 is going to be around. Coronavirus/COVID-19 is going to be around for probably at least another year, and we'll all still need to take these special precautions. We need to know that. It's not going to be in a month where we magically just go back to pre-coronavirus COVID-19 days and times. It's just not going to happen. I wish I could say it will, but the truth is it won't. Maisha Trim says, are you in touch with the medical heads here in Tobago? I think they can benefit from your expertise. Thanks, Maisha. I am talking to some people in Trinidad and Tobago. I wouldn't say I'm talking to the heads of medicine and medical care. I'm certainly open and willing to talk to them if they sought my expertise or assistance. In the meantime, I talk this way and hope to help disseminate information. that way. I've also been talking with people here in the United States and across the globe as well. Talking to virologists, talking to statisticians, talking to some of the modeling folks who include the folks at Johns Hopkins where I did my training. I've been in contact with quite a few people in that regard. I appreciate these questions, guys. Keep them coming. If you have more, keep them coming. In terms of, like I said, places you can find me for information, I'm on Instagram, I'm on Facebook, I'm on Twitter, I'm now on Periscope, I'm on YouTube. And by the way, guys, I'm growing my YouTube. Please subscribe. I'm pretty proud of my YouTube. You know, I started off last week with 6 subscribers. As of this morning, I was up to 39. So thank you to the 33 people who subscribed in the past week. Thank you. I'm working on continuing to have updated content and also really answering your questions. Of course, in spite of all this, I'm still seeing patients. Like I said, I'm seeing patients. I'm working with my staff to procure safety equipment so that we can start getting back to the business of helping our patients grow their families. And really, we're going to need that. You know, we're going to need to help grow families at the end of this. And so that's what I've been engaging my time in addition to outreach and spreading the word directly to you as a patient, but also talking to some of the stakeholders within the media as well. Riva says, hello, Dr. Duke. Tuning in from Brooklyn, New York. Hello, Riva. How are you doing in Brooklyn? You know, you guys have been really hard hit. My first 4 years living in the United States, I lived in Brooklyn, New York. I went to college in Manhattan, Spanish Harlem. I went to City College of New York. And so I actually commuted daily from Brooklyn to Manhattan and back. And so seeing what's happening in New York City certainly hits me hard. And then I went to medical school and grad school in upstate New York, in Rochester, New York, to be specific. That's where I did my MD, my master's degree, and my doctor of philosophy. So this whole state of New York is still by and far the state I've lived the longest in since I moved to the United States. So I am following and watching very closely and aching with you guys, just as if I were living there, I think, in many ways. Of course, my own town here of Las Vegas, Nevada, has been hit hard. We're a city of, if you think of all the suburbs, we're a city of 2 million people, a state of 3 million. And we have at this point almost 1,000 cases. In terms of our hospitals, we are starting to reach capacity in terms of our intensive care unit and ventilators in some of our hospitals here in the city. And that, guys, is despite having shut down the casinos and sort of the heartbeat of the state. That had to be shut down at this point a month ago, next week. And still, these are the numbers we're looking at. Can you imagine what it would have been like had the casinos that house thousands of people individually, if they were all still open and we had attempted to go about business as normal in the state? It would not have been pretty. It just wouldn't have been. And so this is also why I keep telling people, physical distancing works. The reason why it's recommended is not just because somehow somebody wants to be disruptive. It truly saves lives. Anyway, thank you guys so much for tuning in. For those who are watching from YouTube and Twitter, Periscope, thank you. I welcome you. Send me comments, send me messages. If there are any particular topics you'd like to see me address, don't hesitate to message me and I will work on it. Thank you guys, and happy rest of your virtual Wednesday.